Good afternoon. Good afternoon, and thank you for the introduction. Today we have a very important theme, adherence to treatment, and I'm honored to be the first speaker. And one question we should ask ourselves, are we speaking about non-adherence or adherence? Probably both, because we need as well to look what works in adherence and not only what doesn't work in adherence. And traditionally we have a picture with what doctors say and what the patient is hearing, which is not always the same in this case. Probably one of the big issues, but not the only one, and we'll see further in the discussion this afternoon why not. Adherence to treatment is on the agenda. It's an agenda for all the stakeholders. If we look in the last couple of years and even today, it is an important agenda for the public health bodies like WHO, who has it regularly as an item on in their meetings, as well as the EU, and several projects on this topic are financed or were financed by the EU, as well as we did add a private-public alliance, which is called the NCD Alliance. We have as well the professional organizations such as CPME, which is the Commission for Practical Medicine in Europe, or even the pharmacists with the PGEU. These are the community pharmacists in the EU. At the same time, the European Patient Forum, which is representing all the patient associations, is involved and just came out with a policy document last year. So, and finally, because stakeholders are not only those, we have the FPR. FPR is the trade association of all the pharma industry. In September 2011, there was a briefing already from all these groups together at the EU Parliament. And there, the findings, the communication shared that there were almost 195,000 deaths per year in the EU due to misdose or non-adherence of prescribed medication. It is as well estimated to cost in the European Union 1.25 billion annually. So it's not a neglectable topic for us to consider. Some definitions here as well. There is a lot of word used in that. Compliance. Compliance is the extent to which a patient's behavior matches to the prescriber recommendation. Adherence is the extent to which a patient's behavior matches the agreed recommendation. And here we see already a difference, because one is more passive, the other one is an active relation, as the patient needs to agree with the prescriber. And concordance is a more recent word used, which is focuses on the patient-prescriber relationship and interaction, and the degree to which the prescription represents the shared decision. Nowadays, the two words which are the most used are the more active ones, which are adherence and concordance. Another interesting outcome from recent work in the EU is ABC. ABC is Uncertainty Barriers for Compliance. It's a fully EU-funded program which was published in 2012. And one element of this, it was a very big program, but one of the elements is a European consensus on taxonomy of patient adherence. What do we have here? We have first an initiation, but initiation is really the start. Then you have the implementation, which can be better or not, and this defines the persistence. Then you can have a discontinuation, which brings to the non-persistent. And it's a whole cycle together, which is adherence to medication. Yes, but how to manage it? Because what is the cause of non-adherence is often a bad initiation, a suboptimal implementation, or an early discontinuation. And what is the management of the adherence is led by what we see in the pyramid on the left, by the healthcare system, the prescriptions, the community institutions, the providers and prescribers, the family, and the patient himself, of course. So it is a mix of all that which is putting it together. And a very recent study, it's the biggest multinational cross-sectional survey which was conducted in Europe and published at the beginning of this year in the BMG, was conducted. It's a survey, it's not a clinical trial, it's a survey. The objective was to examine the intervention of healthcare professionals used to support patients with taking medicines and their prescription about the effectiveness of those actions. It was an online survey in Austria, Belgium, England, France, Germany, Hungary, Netherlands, Poland, Portugal, and Switzerland. You will say it's not all Europe, but it's a reasonable number of countries, and a total of 3,196 healthcare professionals have answered, and this comprised doctors, nurses, and pharmacists. When I speak of pharmacists here, it's community pharmacists. The results are approximately half of the healthcare professionals in the survey asked patients with long-term conditions whether they have missed any dose. Only half of them on a regular basis. Pharmacists personally reported they intervene less than the other two professions. So we can imagine if the other it's only half, it's even less. In the study, there was no country effect. We could not say that there was more in one country than another. It was very similar result. And the conclusions of this survey were that healthcare professionals in Europe are limited to the extent to which they intervene to assist patients having long-term continuous medication adherence. This represents a missed opportunity to support people with prescribed med treatment. And this is my last slide. We can really see what fits to doctors in his relation. And as we will speak as well about social media, here I have another picture. How do I choose my doctor? One has retweeted me and the other one has not enough friends on Facebook. It's probably not what Bastien will share with us, but I think it's one way to see it. And I thank you for your time.